Hi everybody, it's Mike Putman from Room Now, reporting live from ACR Convergence 2023. Now today I'd like to report on abstract L03. It's one that I didn't expect. It's entitled The Efficacy and Safety of Targeted Therapies in VEXAS Syndrome, a retrospective study from the FriendVax group. Now this is a very cool topic. We have all learned about the VEXAS syndrome, which is a new disease in rheumatology, and what I haven't really known yet is how to treat these patients. We don't have enough of them yet for most people to be able to make any strong statements, and frankly, I don't understand the pathophysiology in the same way that I do a lot of our other diseases. Now, that made this abstract particularly interesting. This was a multi-center observational study in France. They followed 110 people who were given various types of therapies to see how they did over a couple-year period. It's already the largest series of VEXAS that I have seen, and it's kind of interesting because these patients got a lot of different therapies. Some of them got JAK inhibitors, some of them got IL-6 inhibitors, some of them got IL-1 inhibitors, so you can see people are kind of treating them like an autoinflammatory disease because we're still not sure what to do, and the results are quite striking. So they presented their primary way of presenting the results was to say, which therapy survived. It's a common misconception. People think we're talking about survival of the patient, but we're saying how many patients continued on the therapy without stopping it. That's a useful surrogate for did the therapy work? Because when therapies don't work, we stop them. So in this case, of the therapies the patients were given, which therapies survived the longest? Well, it looks like it was far and away JAK inhibitors. The rates of JAK inhibitors at 2 years out were far higher than some of the other drugs. IL-1 inhibitors in particular, most people who took them stopped them up front. IL-6 inhibitors did a little bit better, kind of in between. But among patients who received a JAK inhibitor, there's a stronger association with people being on the therapy going forward. So this is very preliminary. This is not randomized. This is still a small study, and it's observational data, so it's kind of complicated to fully trust it. But at the end of the day, for me, going from not knowing really much at all about what to do for these folks to seeing a relatively good signal for benefit for JAK inhibitors makes me feel that if I were to see a patient with VEXAS and they said, what kind of immunosuppression should I consider, I think I would consider JAK inhibitors, then IL-6 based on this data. Thanks so much for tuning in to Room Now. Hope to see you all at ACR Convergence 2023.